The Arab culture. The Arab culture group is not defined by its ethnic background, but is unified by its history and culture. This culture group is composed of a diverse group of people and rely heavily on traditions and beliefs. An Arab is someone who speaks Arabic as their first language or whose ancestors spoke Arabic as their native tongue. People of this culture follow different beliefs, have migrated to countries all over the world, and belong to different types of groups and societies. The Arab culture includes over 22 different countries or areas and exceeds from the Morocco across North America to the Persian Gulf. According to the United States Census, 1.5 million people of Arab descent live in America. This accounts for 0.5% of the United States' total population. It is very important to notate that the Arab American Institute estimates the total population number to be closer to 3.5 million Arab descent Americans, with claims that the census has a poor wording and question placement, allowing for misinterpretations. The cities that are largest in Arab American populations are Los Angeles, Detroit, New York, Chicago, and Washington, D.C. 13.7% of Arabs live below the poverty line. However, this figure increases to 28% when including single mothers. Applying the $1.25 a day poverty line, extreme poverty affects less than 5% of the population of all Arabs. Even when applying the $2 a day poverty line, estimates should suggest less than 20% of the total population in Arab countries live below the poverty line. In 2011, the life expectancy of Arab males was 75 years, while females was 76.7 years. The top causes of those deaths were coronary artery disease, stroke, and hypertension. Because of the Arab population not being defined by its ethnic background, a bicultural variant is very hard to be identified. There's an alarming increase, however, in the non-communicable diseases in the Arab cultures. These diseases include cardiovascular disease, cancer, chronic lung disease, and diabetes. The behavioral risk factors include tobacco use, unhealthy diets, and physical inactivity. Diabetes is prevalent in adults and children of the Arab population.
Communication styles. The primary language is Arabic. Other languages within the culture are English, Hindi and Pashto, Bayoqui, Tagalog, and Persian. The Arabic culture emphasizes establishing a relationship prior to discussing business. Common practice is to provide 2 feet of personal space when engaged in conversation as opposed to the American preference of 5 feet. Arabs touch often, and the closer proximity allows them to interpret the nonverbal cues of those they are engaged in conversation with. Cultural affiliations. Religion. Those associated with the Arab culture are primarily followers of the Quran, which was written in Arabic. The Quran offers strong guidance in the way of life for its followers. Christianity and the Jewish faith are also practiced by many. Islamic teachings. The Arab culture is a conservative society that weighs heavily on Islamic teachings. Since the 1800s, when Arabs began migrating to America, there have been various social and political organizations set up to preserve and celebrate their heritage. Examples include newspapers, radio shows, the Syrian Lady Society of New York, the Federation of Islamic Associations of the United States and Canada, and annual festivals which developed into banquets and national conventions. They were created to introduce young participants to others sharing the same beliefs and celebrating their culture. Sanctions and restrictions. Women's rights. In Arab cultures, a woman's value is primarily based on her part in raising and caring for her family. Women are to dress conservatively in order to avoid creating temptation. Marriages. Arranged marriages are more common in Arab culture, and 25 to 30% of marriages are consanguineous, meaning they're marriages between two people who share blood. They're usually between cousins. Developmental considerations. Education. Education is recognized as being a weak point in Arab culture. While attendance in school may be high, the quality of education is not up to par. Economics. Oil. Oil is the primary economic factor in Arabic countries. The oil business has created an influx of non-Arabic people into the Arabic countries, which is creating more cultural diversity in the healthcare setting.
Education of Arabs, only 89% have a high school education, 45% have a bachelor's degree, and 18% have a postgraduate degree. More than 5 million people cannot read and write. Education is controlled by political and religious groups. The schools are highly attended but have little resources and deliver a poor quality of education. Children frequently withdraw from schools, especially in rural areas, due to the distance needed to travel to attend. Girls often are not allowed to attend schools because of decreased security. Western medicine is respected by Arabs, who consider the germ theory plausible, but also have health benefits based on folklores. Most causes of illness include the evil eye. Positive events invoke jealousy, giving the envious party power to inflict misfortune. Cold or dirty environments, heredity, or punishment from God. Preventative care is not practiced. Arabs prefer to be treated with medicines. The Arabs desire injections as opposed to oral medication. Hospitals are considered a place of bad fortune and associated with death. Privacy is strongly valued, and families may be reluctant to disclose personal information. Traditionally, the man of the house accompanies his family to all doctor's visits, where he acts as the family spokesperson. Arab culture appreciate receiving bad news about their health slowly or in phases. Prior to the Gulf War, Arabs living in Arab countries had benefits, Social Security programs for retired and disabled individuals, short-term disability assistance. In 2011, an average of 7.8 doctors accounted for 10,000 people's medical care. Doctors refused to work in some areas due to safety and security, making health care unavailable to many. Vaccinations are infrequently given. Family is the most important social and economic institution. Traditionally, parents live with their oldest son. The senior male is the head of the household. Children are separated by sex, and boys are granted more freedom than girls. These strong family ties bind generations together, helping to preserve culture and tradition. People from Arab cultures work and socialize together, creating an environment where the well-being of the whole group is more important than that of an individual. The United Nations provided those in Arab countries with assistance in nutrition. During this time, the Arab diet consisted of rice with soups or sauces, with lamb and vegetables. Today's Arabs are eating rice or other grains with sauce, if available, as meats and vegetables are hard to obtain. The food pyramid, recognized in America as dietary guidelines, is also recognized by Arabs. However, in recent years, attempts have been made to customize these guidelines for Arabs with creation of the food dome. This was done to reduce the diet-related diseases in Arab populations, especially heart disease, hypertension, obesity, cancer, and diabetes. The primary religion of Arabs is Muslim. However, it is a misconception that all Arabs are also Muslim, as many practice alternative religions such as Christianity, Judaism, and Catholicism. Arabs are a highly spiritual group of people, and based on the status of their health on where they feel they stand with God.
Values orientation. Arabs have strong family ties with immediate and extended family members. They are a modest group of people who prefer to keep themselves well covered. Arab traditions are based on patriarchal ways. Women have important roles in the family, such as raising the children and maintaining traditions, but they are expected to be completely submissive to the male leader of the household. Customs tend to center around hospitality and food. Socialization with the family and friends is an important part of this culture. Higher education is desired. Economic wealth is considered an important achievement. Physical assessment findings. Because the Arab group is made up of an ethnically diverse group of people that are interconnected by their beliefs and traditions, it is not feasible to associate a definite physical assessment with this group. However, common health issues among Arabs are similar to those of Americans and include cardiovascular disease, cancer, diabetes, and obesity. Due to the high number of consanguineous marriages, 3 to 5% of all live births among Arabs suffer congenital birth defects. Culturally specific values and issues. Because of the focus of the family and the need for interaction among loved ones, Arabs often reside with multiple generations under one roof or within one compound. Consanguineous marriages remain prevalent today for the purposes of maintaining family wealth. Arabs have negative attitudes about dating and premarital sex. They believe that a woman should be pure and not even learn about sex until her wedding day. Chastity is given much value in this culture. If a woman's chastity is not honored, shame and misfortune could befall her family. Implications for clinical practice. Providers need to be prepared to deliver culturally competent care by considering the needs of their Arab patients. In the clinical setting, providers can introduce themselves, take time to establish a relationship with these patients, which will encourage them to disclose necessary details of their health concerns. Language can be a barrier, and the use of interpreters should be considered. Clinicians should remember to stand closer to an Arab patient when talking and to always address the male representative of the group. Due to the lack of preventative care, clinicians need to be prepared to treat more serious ailments or conditions. Healthcare providers need to consider the Arabs' belief of the etiology of their illness, realizing that patients may not accept treatment if they don't feel the clinician believes them. It is not necessary to change a patient's mind about how or why something happened. It is more important to agree on the treatment that is required to heal.
Hello, my name is Nancy Hannafin from the Department of Nursing here at Towson University. I'm going to talk to you today about creating culturally competent healthcare Cultural competency requires a commitment from healthcare providers to be responsive to the different attitudes, verbal cues, and body language of the patients that they are caring for. It may not require that the healthcare provider uses the same methods of healthcare in the country of origin, but it does require that the healthcare provider has a familiarity with those countries of origin. Understanding the different cues in the healthcare settings will help to improve patients' satisfaction and healthcare outcomes. In 2001, the U.S. Office of Minority Health created the CLASS standards. CLASS stands for Culturally and Linguistically Appropriate Services. This is a series of 14 standards that are recommended guidelines to provide appropriate services for patients of all populations. When utilizing these standards, you have to remember that one size does not fit all, and you cannot stereotype any particular culture. You have to recognize and ask your patient, what is it from their culture, what part of it do they want to infuse into their health care so that you can assure them of a more satisfying patient outcome. In 2 minutes, we cannot even scratch the surface of identifying the diverse cultural needs of our patient population. But with a commitment to cultural education, we can provide a new dimension to culturally competent care and patient satisfaction. Any reason to celebrate someone's diversity and to recognize something that's unique and special to a certain group of people benefits all of us.